scanning the room. Alright, my name is Kat Casada, and today I'm doing the Musculoskeletal System assessment on my patient. Do I have your permission?
Yes.
Alright, so first I'm going to start by inspecting the temporomandibular joint, noting any tenderness, making sure each side is symmetrical. I'm also looking at the skin, making sure there's no lesions and making sure it's smooth. Alright, can you open and close your mouth? Good. I would note any crunching noises. Now I'm going to check her range of motion. Open your mouth wide. Good. Move your jaw side to side and move it out. Good. Now we're moving down to the cervical spine, making sure her head is aligned with her neck. Can you move your chin to your chest? Up to the sky. Good. And ear to shoulders. Good. And I would also feel her trapezius or sternomastoid and move down to the shoulders. So for the shoulders, I'm going to feel for any atrophy, checking the capsule of the joint, noting any tenderness or nodules. Can you flex your arms, please? Good. Extend back. Good. Internally rotate and externally rotate. Good. All right, and then I'm also going to check for crepitus while she's doing those ranges of motion, and then I'm going to check her muscles by pushing down on her shoulders as she lifts them up. Good. All right, next we're moving down to the olecranon process in the elbows, noting the skin, making sure that it's smooth, wrinkles are normal, making sure there's no nodules, and then making sure that they're both symmetrical. So for elbows, we're going to check your range of motion by bicep flex. Good. Extend. And then pronation, supination. Good. And then for this test, we're going to check her strength by pushing and pulling. So if you pull, and then push. Good. All right, so now we're going to move down to the wrists and fingers. We're going to be checking the joints, making sure that there's no swelling, tenderness, nodules. Same thing goes for around the carpals. Feeling each of those joints. Good. Inspecting both sides of the hands, looking at the skin, making sure that it's smooth. Also making sure that your fingers are aligned with your hands. Good. And now we are going to do check your range of motion. So if you could extend your hands, flex your hands. Good. And then spread your fingers, make a fist, and then move your hands side to side. Good. And now we're going to do the Fallon's test, checking for carpal tunnel. Put your wrists together. If the patient were to feel a burning sensation, they would have carpal tunnel. And then we're going to do the Tillen sign, which also checks for carpal tunnel. And you just tap the wrists, and if they feel any pain, then they would show it. All right, so now we're going to move down to the hips, looking at the alignment, feeling for any atrophy. Now we're going to check the range of motion. Please bring your legs both out in front. Good. Now knees to chest, one at a time. Good. Externally rotate your hips. Good. And internally. Good. Now we're also going to have you put your feet together. Yeah, internally and externally rotate. There you go. All right. Now moving down to your knees, we're also going to palpate these, noting the tendon, making sure that there's no swelling or atrophy. There's no atrophy. All right, now we're going to test your knees, range of motion. Good. Good. All right, and now for strength, I'm going to have her push against my hands. Good, and pull back. Good. Also make sure that they are symmetrical. Now we're going to move down to the ankles and feet, noting the toes, making sure that they line up with the legs. Same, making sure that they're symmetrical. I'm going to palpate each joint, noting any swelling or tenderness. Same for the ankle. And feeling all the metatarsals, noting any nodules. Good, and now I'm going to have you flex your feet and point your toes. Good, and then for this strength test, I'm going to have you push your feet against my hand like a gas pedal. Good, all right, and lastly, we're going to have you look at your spine. So if you stand up and turn around, we're going to look at the shoulders, making sure that they are aligned. Same with the scapulas and the iliac crests. You're also going to look at the gluteal folds, making sure that the spine is straight, and then take your hand and run it down in a vertical line. You're also going to palpate and note if you feel any tenderness. Should be a little tight. Good, and now for these strength tests, I'm going to have you bend over. Good, come back up, lean side to side. Good, back, lean back. Good, and then twists. Good, and that consists of musculoskeletal system.